Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Multiple sclerosis. Multiple sclerosis is mainly characterized by either relapsing course, or it has remitting course, or it has progressive course. So, in the multiple sclerosis, we have a triad of symptoms. We have a triad of symptoms where in the multiple sclerosis there is CNS inflammation. In the multiple sclerosis, CNS inflammation is present along with demyelination, and also demyelination is present along with gliosis is also present. So this is the pathological triad of multiple sclerosis. In the pathological triad of multiple sclerosis, we have CNS inflammation, demyelination, and gliosis. Next, actually this multiple sclerosis is a disease which occurs due to the dissemination in time and space. This multiple sclerosis is exclusively a disorder of peripheral nervous system and central nervous system, white matter disease. Here the problem is in the white matter. Risk factors of multiple sclerosis. In the risk factors of multiple sclerosis, it occurs due to the females. It occurs in females more commonly than males. The females are almost 2 times more affected than males. Positive family history is seen in the multiple sclerosis, along with HLA-DRB1 association is present. Gene association is present, especially in class 2 region of MHC. Then there is also presence of myelin basic protein is also seen. There is presence of myelin basic protein is present in the multiple sclerosis, and the against this myelin basic proteins T cells are produced. So there is myelin basic protein reactive T cells are present. Autoantibodies are also present against the myelin oligodendrocyte glycoprotein. So antibodies are present against the myelin oligodendrocyte glycoprotein antigen. Okay, and then we have HHV type 6 is associated with it, with chlamydia. Pneumonia can also be associated with multiple sclerosis.
thank you and thank you for watching.